And then we
All right, thank you all. We're in our home stretch for COPRHCon, just a couple hours to go. And I've really been looking forward to this particular talk. Dr. Julia Moore is from the Center for Implementation, and will be talking to us about the Mapped to Adapt tool, a roadmap to plan for adaptations. This is a very practical application of planning for adaptations. And Dr. Moore is internationally known for her ability to communicate complex implementation science concepts in clear and actionable ways. I know I need that. Her experience in the field spans more than a decade and includes working on over 100 implementation projects in 8 countries. Her passion for supporting the real-world use of implementation science is shown through her commitment to the spread and scale of accessible training. She has led and designed tailored courses and workshops for over 2,500 professionals from a wide range of fields. She also developed the popular online mini course, Inspiring Change, Creating Impact with Evidence-Based Implementation, which has been completed by over 5,000 professionals from around the globe. We talk a lot about implementation science and practice. I think this talk will really show the intersection between those two things and show how we can truly apply what we've learned in implementation science to this important work of adaptations. So thank you, Dr. Moore. Take it away.
Awesome. Thank you, Bethany. And I am so excited to be here. I know that some people are a little tired after lunch, but I promise we'll have a little more interactivity today. So get ready for that. Also, if you want to turn on your camera, I love being able to see a couple faces as I'm presenting. So no pressure. I know there's Zoom fatigue, but I also love seeing people while we're talking. So as Bethany said, I am really going to focus today on some practical and concrete guidance that you can use to think about planning for adaptations. And honestly, Graham Moore could not have set it up better this morning. If you got to see this morning's plenary, talking about how we can do a better job of really planning for adaptations. We've moved away from the question of should we adapt or not to we have to adapt. And so what does that look like? I'm going to describe a few key concepts related to adaptation, but I'm not going to go into them in detail because some have been covered and there's breakout sessions where you will deep dive into even more. We'll talk about how you can use strategies to more systematically approach adaptations and a little bit about classifying those adaptations. I also want to flag, so there's a 2-page handout that you can download, but we actually have a much broader workbook that accompanies this presentation. And Mike, if you could put that in the chat box, that would be great. People can download it. It includes, I think lots of people love at the back, there's 31 adaptation references categorized into different groups. And so lots of people have said that's really helpful. We are going to have some interactivity. And so I want to start us off by doing that right now. We are going to use the Annotate feature a couple of times today. So I would like everyone to go to the top of your screen and it should say View Options. I want you to hover over View Options and it should have the word Annotate written below that. When you click on Annotate, all of a sudden you should have a bar that shows up on your screen. And that bar will include a bunch of different things, including a stamp. That's my personal favorite. So take a stamp, any stamp you want, and place it where you are in the world. So most of you are from the United States, but I've seen a couple of people who I know are not. Perfect. And so if you are not, you could also write on the screen using the text feature where you are. So I, for example, am right there up in Canada. So it is worth it to take a moment to do this because we will annotate a couple of times today. And so that would be great. Awesome. So most people, so a few Canadians, in fact, lots of people, not surprisingly in Colorado, but great to see people literally coast to coast. Oh, a few Canadians, I saw, I think some of these Canadians on in an earlier talk. So really, really great to see representation kind of around the board. So I'm going to clear those, but get ready, you will annotate again. So don't get rid of that bar yet. And jump into, so luckily Bethany introduced me. So I am kind of a, sort of jokingly say, rogue scientist, trained as an implementation scientist, but spend all of my time figuring out how we can support people to use implementation science to guide how they actually implement, spread, and scale interventions. So working with people who are in a variety of roles, researchers, policymakers, implementers, government organizations, non-government organizations, really helping them use the science of implementation so that they better design, implement, spread, and scale those interventions. And so we spend a lot of time training and supporting people to actually do this through the Center for Implementation. And what I'm going to talk today about specifically is how we can build a bridge between implementation research and implementation practice, specifically related to adaptations. And I think this aligns so beautifully with the work you've been talking about related to pragmatic research. Because at the end of the day, you are trying to do research that is going to have an impact. And so thinking about this bridge between the research and the practice is so central to that. One of the things I just wanted to kind of lay out at the beginning, I think lots of people will have seen a slide that looks a lot like this, but I think it's worth it to make sure that we're all kind of on the same page. Dissemination and implementation kind of exist on a spectrum. Right at one end of the spectrum, we have dissemination, the act of sharing information, ideally bidirectionally. And at the other end, we have implementation, where we're using strategies to change people's behavior. There are researchers out there doing the science of implementation, many of them on this call or on this series throughout this conference. And they are thinking about how can we best implement evidence in practice, and really asking great research questions, ideally pragmatic research questions, on how to do that. There is also a practice of implementation, which is the act of actually using those strategies to change people's behavior to implement the evidence that we want people to use. Ideally, the science of implementation is used to inform the practice of implementation. And what's happening in practice should also inform what researchers are doing. And so I'm going to talk about one of the ways in which we have kind of translated the science of implementation specific to adaptations to help guide how we can actually implement adaptations in practice. And I see there's a bunch of new people who have signed on. Thank you, Mike. There is a full workbook related to all of this with all of these visuals, if that is helpful for you, in the chat box if you follow that link. And so one of the ways that we like to think about implementation research and implementation practice is that there is kind of like a bridge between research and practice. And implementation researchers are out there building bricks and elements of that bridge. They're figuring out what are the best strategies. What are the forms and functions of those strategies to change people's behavior? What contextual factors affect implementation? What do implementation outcomes look like? And all of those kind of make up bricks in this bridge. The role of implementation practitioners is to actually take people across the bridge and bring that research into practice. And so what we have done is we spend our time trying to translate implementation research and all of those bricks and build an actual bridge to help people cross it. We sort of see this as being two really big bridges. One of them is about how we can better design our interventions for implementation. A lot of people think about that as how do you select the implementation strategies you need to change people's behavior. That's not the entire bridge, but that's kind of the element that people think about the most. The second one is about implementation, spread, and scale. Because we don't have much time, I only showed the first bridge here. And it sort of shows how we take people along this pathway, and you can think about all of these things that are completely relevant to researchers and practitioners. A small note that underlying the bridge, the foundational components are a bunch of relational aspects that are really central to all implementation work. Things like, how do you build trusting relationships? How can you address power dynamics? How can you persuade people or get people to have shared mental models of things? And these are so important for the work of adaptations. And so when we think about designing interventions for implementation, one of the really common things that happens is people realize we need to make adaptations. We have heard this for years and years, and people say there are great frameworks out there about adaptations, but most of them tell us how to assess adaptations that happened, but they don't provide step-by-step guidance on how to actually adapt. And so that's why we developed the map to adapt, which literally draws together the theories and models and frameworks from implementation science and says, how can we make a pathway or a map so that people can think step by step, how can I actually plan for adaptations? And so I feel like this builds directly on what Graham Moore was talking about this morning. This comes directly, the components of this, I'll go into each of the components in a little bit, build directly on adaptation frameworks, including some that are going to come out in breakout sessions in a moment. Things like the FRAME framework, MADI, IAM-ADAPT, and the ecological validity framework. One small note before I get into lots of detail is I think it's really important to mention that the science of adaptations is really complicated. And we are trying to provide concrete and practical guidance, which means that there are moments that we are sometimes oversimplifying things to make sure that everyone gets on the same page. And then once that happens, people can dive deeper into some of the topics. So with that, I think it's really helpful to start by thinking about, first, when are adaptations even made? Adaptations can typically or can happen at one of three different stages. Sometimes we make adaptations during the design phase when we're planning for implementation. Sometimes we make adaptations during implementation once it's actually started, but they are still planned adaptations. And sometimes we have unplanned adaptations that we did not plan to make. I am going to focus on the first two situations. What happens when you're planning for adaptations during the design phase or during the implementation phase? I'm not going to focus on unplanned adaptations because those are really going to be tapped into in the breakout sessions. And so the map to adapt this is really the first half of it, focuses really on how can you plan for those adaptations. And it links on to any process model in implementation that you want. So if you use EPIS or NERN's active implementation, it maps directly onto those. And in the first phase, we talk about exploring fit. So when we think about exploring the fit of an adaptation, there are really 6 activities that we want to think about. So say you have an intervention and you're like, okay, we're thinking about adapting. This is a step-by-step. What does that really look like? Number 1, gather a small team. This will often be, say, your research team or the team that you typically work with. Then you sit down and think, what is the original intervention that we are trying to implement? So really clearly define that original intervention and ask the question, what is the purpose of making this adaptation? Like, what's our objective? Why do we think we need to make any adaptations at all? This seems like a small thing, but you would be surprised at how many projects that we have seen where people are adapting without really understanding why it is that they're making that adaptation. Once you have asked the question, what is the purpose of making the adaptation? Then you can start asking the question, are we making adaptations to the people, to the inner setting, or to the outer setting? For example, you might make adaptations to the people because you're delivering the intervention to a different group of people that it was originally intended for. Or maybe the people actually delivering the intervention are different than the original people delivering the intervention. You might take an intervention and implement it in a new setting. And so you've changed that inner setting. And you might take an intervention and implement it in a completely new outer context. For example, a new country, or maybe even a new part of the country. We see this when you take maybe an intervention designed in an urban setting and bring it to a rural setting. Once you have done that, I'm going to jump back. So you've gathered your small team, you've defined your original intervention. You say, what's the purpose? You think about those three things. Are you changing the people, the inner, or the outer setting? Now it's really important to stop and say, since we know who is involved in this, we need to gather a larger group of stakeholders and make sure that those people are at the table, particularly the people who really understand the setting in which you're implementing this intervention. So you now have this larger group of people to help plan what are these adaptations going to look like. The last thing that you do before you move on to actually designing those adaptations is ask yourself, is this intervention really the right fit? We see lots of situations where people move forward with making adaptations to an intervention, and they later realize the adaptation wasn't, or the intervention wasn't close enough to their target audience or the target setting for it to really be worth it to adapt that intervention. So it's really, really important to pause and ask, is this the right intervention and does it really fit? Before I move on to talk about how we design those adaptations, we are going to do a little activity where you get to actually think about categorizing them to these different potential categories. Because I think that can really, really help kind of illustrate what this might look like. So, and Borska, I see your question, and so I'll jump into those. I have some time for Q&A at the end, so make sure to flag that one. So in this activity, pull out your Annotate again, and I'm going to jump through a couple of examples. I think I have 4 examples. So imagine you are working on a project, and you have an intervention where the original intervention was about increasing mobility, so getting people out of bed in the hospital, specific to older adults. So there's a lot of research that shows people go to the hospital, they lay in a bed, bad things happen if you don't get up. So this intervention is about getting people up and walking while they're in the hospital. Now you are taking this intervention and you want to deliver it to a similar group of older adults, but not in a hospital, instead for those living in long-term care homes. Is this an adaptation to the people, the inner setting, or the outer setting? And I want to flag, obviously you might not have enough information to know all of the pieces, but kind of a first guess based on 2 sentences that you have. So you can annotate with your little check marks. Do you think that this is, are we changing the target audience, the inner setting, or that outer setting? Fabulous. So we would typically call this an inner setting adaptation. We're taking it from one context, right, hospitals, and putting it in a different kind of organization, long-term care homes. Sometimes when I've done this kind of example, some people say, well, the people might be a little bit different. And yes, it is true that the people might be a little bit different. And in fact, always the people are a little bit different, but the primary difference here is really at the inner setting level. Let's go through a second example. Now imagine you have a community-based behavioral health intervention. You want to implement the intervention in the exact same location, but now you want to focus on undocumented immigrants as the target audience. Are you changing the people, the inner setting, or the outer setting? And I see while people are putting that in, Bethany commented on the idea of push and pull and kind of demand having a pull model. And we've actually used this map to adapt almost more with kind of that pull model than the push model. So it can definitely apply in both of those situations. So exactly. So this is about changing the people. We've changed the target audience for this intervention. Third example. Imagine, okay, so this is a project we worked on years ago. There are WHO guidelines for women who have a baby and then have postpartum hemorrhage. And the first line of therapy says you should give them misoprostol. But there are some countries in the world, like Senegal, that don't have misoprostol literally in the country because it can be used for abortion as well, and that is illegal. And so they don't want this drug in the country. So essentially we have an intervention where we're now implementing it in a new country and they don't have access to the same drug. So are we changing the people, the inner setting, or do we need to make adaptations because of the outer setting? Fabulous. So yeah, so this is an example of more of that outer setting. So I wanted to give an example of each of those. Our last example is a little bit more complicated, not a lot, but a little bit more complicated. Imagine you have a youth pregnancy and substance use prevention program, and it was designed and tested in New York City. And now you want to deliver it in a rural, conservative, religious community that has high teen pregnancy rates. Are you making adaptations because the people are different, the inner setting is different, or the outer setting is different? Awesome. So I purposely included this one because it's a little bit more complicated to show that realistically, these aren't often super, super streamlined. And you probably need more information sometimes to really deep dive into what level you're changing. Having worked on a project like this, there's definitely some changes to the outer setting because we're working from one context to another. But there are also some changes in the actual people in the target audience because the people in New York City looked quite different than the people that we're targeting in this rural conservative religious community. And if you are working with different kinds of organizations to deliver that intervention, you could also be changing that inner setting. But hopefully it gives you a flavor for the kinds of ways that we can pause and really think about why are we making this adaptation and what aspects are we thinking about adapting? Once you've done that, then you're ready to start actually designing the adaptation. And honestly, so many people want to skip all those steps and jump right to here. But if you don't know why you're making adaptations and what aspects you're adapting, it's going to be a lot harder to do the next pieces. So now when we get to designing adaptations, I want to note that there's 6 steps here, but unlike the 6 in the first one, they're really not steps that are sequential. In fact, we'll go through them and you'll see that they kind of all happen simultaneously and back and forth. So they're really not sequential. They're activities that all have to happen, but they can really help you tease apart and plan for your adaptations much more systematically. So first is really thinking about why does an adaptation need to be made? So oftentimes people just say, well, an adaptation needs to be made because the people are different or the context is different. But pausing and asking yourself, what is different about this target audience? What is different about this organization? What is different about this setting that makes it that we really need to adapt? For example, when people say, well, we're focusing on a different racial or ethnic group, it's not actually the racial or ethnic group that is the reason you need to adapt. It might be because of structural racism things that are happening that you need to address. It might be because of different social norms in different groups as you move, for example, between countries. So it isn't actually just saying, oh, this group is different. It's really tapping into why are they different so that you can unpack that and get to the next pieces. When you do that, you want to start to really articulate and write down the specific changes that people are going to make when doing this. So what are those specific adaptations? As you start brainstorming that and talking about that with people on your team, chances are you're going to have some intense conversations sometimes because people are going to conflate different components. And so I'm going to talk about some pieces we can parse apart that can help you better understand and plan for the conversations you have with different stakeholders. For example, you can ask yourself questions about whether you are making adaptations for cultural reasons or logistical reasons. So yesterday, Noi gave a fabulous talk about cultural adaptations in a situation where people have different value or belief systems. And so we need to make adaptations, these cultural adaptations to address this. At the same time, there's other adaptations that we need to make because of logistical reasons. So first, let me give you an example of cultural. So we have a colleague who has been working with a parenting intervention that was designed in the United States and is being implemented in Chile. And he needs to adapt this intervention to the Chilean context to really address the needs and the different values and belief systems between parents and families in Chile versus the United States. So an example of a cultural adaptation. An example of a logistical adaptation, I think that we've all experienced and literally are experiencing right now, is when we had to go virtual versus do things in person. This is an adaptation that wasn't made for underlying values or philosophical reasons. It's a logistical thing that we have to deal with. So there's lots of logistical reasons we need to make adaptations to fit things into schedules, to fit things into timeframes, into organizations. And teasing apart whether adaptations are cultural or logistical can be really helpful because sometimes those are contentious conversations when people haven't really disentangled them. The next thing that's really, really important is to disentangle whether you're making adaptations to the what or adaptations to the how. So the what might include things like a guideline or an evidence-based program or maybe a screening procedure. It's the thing you want people, normally clinicians or professionals of some kind, to do differently. Sometimes we want to make adaptations to that what, and sometimes we want to make adaptations to the how, the implementation strategies or change strategies we're using to actually change people's behavior. Things like education, reminders, audit and feedback, champions, facilitators. And sometimes we're making adaptations to both. And I would say the most contentious adaptation conversations I've been a part of are in situations where people are struggling to disentangle, is it an adaptation to the what or the how? Then, once you've teased apart those pieces, you can really start to think about what are these kind of adaptation strategies. And this is from the ecological validity framework. And it really helps you think about what does this adaptation literally look like? For example, are you adapting the language? Maybe you're taking something from English to Spanish, but you could also be making adaptations like we worked on an intervention that was designed in hospitals and brought into long-term care. And in hospitals, they call them patients, and in long-term care, they call them residents. And so we need to change the language of this intervention to really align with that target audience. Next, we also need to make adaptations to the metaphors or the analogies. So we don't often realize it, but the way that people communicate is often through analogies and metaphors. It's one of the ways that we help people understand what's happening in the world. And sometimes our analogies and metaphors are really grounded, or they often are, in our kind of worldview. And if you're working with different target audiences, you might need to change those analogies or metaphors. So a great example, my colleague, Sobia Khan, has been working in Uganda and Tanzania, building implementation capacity with district health workers there. And we have this analogy related to kind of building a house that we use to explain some implementation science concepts. And they came back a couple of months ago and shared with her and said, hey, we reworked this for our context. And instead of building a house, we're using a tree analogy to talk about these different components with like the roots of the tree and the leaves growing and the bark and all these different components. Because that analogy resonates more with them and their target audience than our original analogy. And so that's a great example of the kinds of adaptations that sometimes need to be made. The third kind has to do with adapting concepts. These are the underlying principles within an intervention. Often people are very hesitant, especially implementation researchers and intervention developers, to make adaptations to these. But sometimes it does happen. And we've seen one great example that I've seen several times in fact, is smoking cessation programs often talk about being kind of all smoking is bad. But when people are implementing smoking cessation programs with Indigenous communities where there's ceremonial tobacco use, they need to make some adaptations to those underlying concepts to account for this cultural, this is a cultural adaptation to account for this cultural difference with ceremonial tobacco use. So that's where you're tapping into those underlying concepts or philosophical components. Next, we have adaptations to the content. So these are the ones we kind of think about the most often. So I do these all the time, and probably you do too. So I give a lot of talks and training to a lot of different groups. Last month, I gave a talk to a group of pharmacists. And this month, I gave a talk that had some similar components to a group of people who are working with children with autism in schools and communities. And so I needed to adapt the examples that I used to be relevant for pharmacists and then relevant for people working in schools and communities with children with autism. And so it's an example of where we're adapting the content to align with the target audience. Finally, we can make adaptations to the delivery. For example, is something delivered virtually or online or virtually or in person? You might also change the person delivering something. And so those are adaptations that we might make to the delivery. So that is a lot of information about all of those different components. And so that is in the workbook that Mike put in the chat box there. So you can see all of those different pieces because I know those are a lot of pieces. But those can really, really help you and your team sit down and say, okay, what would this adaptation look like for us? And how can we sort through how we're going to plan for it? The last component or element or activity in this phase is to really pause and hypothesize the impact of that potential adaptation. So once you know what adaptations you're talking about making, you want to ask the question, is this likely to change the effectiveness of this intervention? And if it is, you want to stop and say, do we really want to move forward with it if that's going to happen? Sometimes I've seen situations where the answer is yes, and sometimes the answer is maybe we need to adapt it differently. So it's really important. Remember, at the end of phase one, you say, does this fit? And at the end of phase two, you say, is this going to affect effectiveness? And if it is, what am I going to do? So that is an extremely high level overview of the map to adapt. Before we get into the kind of final wrap up, I wanted to ask people about, given that there's actually been a lot of conversations about adaptations so far and getting you into the breakout sessions that are coming up, what do you think that you could do to approach adaptations differently moving forward? And so we'll get everybody to pull out their Annotate feature again. And this time, instead of just doing a check mark, can you pull out the text box? So if you pull out the text, you can literally type, put it on the screen and type something on the screen related to what you think you might be able to do differently. So we'll give a moment as people start doing that. Oh, and some people are having trouble. I see some comments to me in the chat box. So if people want to also type it in the chat box, you can do that. And you can type it to me anonymously if you don't want it to show up. So I see adapt to delivery by lay health workers. Excellent. Consider which level is leading to the adaptation. Amazing. Ooh, I have someone who has written to me and said, gather a broader stakeholder group than our small team. That is excellent. Approach adaptations more systematically and thoughtfully. Fabulous. Let me just move these around. Thinking about it much more. Get agreement on the purpose of the adaptation. Absolutely amazing. Research differences and issues between where you are coming from and where you are going. Be sure that all the stakeholders are there. Ooh, amazing comments. So with that, let me clear our screen and kind of jump into so I went over really quickly one way to think about how you can more proactively plan for adaptations. Oh, and fabulous. Someone just said being more proactive about hypothesizing adaptations that might occur and what that will mean. So I hope that this helped you think about different ways to think about and approach adaptations and how you can bring that back to your team. I just wanted to flag and understand that adaptations might be an iterative process. Oh my goodness, that is so true. So kind of final wrap up, wanted to flag for anyone, and we're gonna get into Q&A, for anyone who wants to know more about how we're thinking about how you can use implementation science more in practice. We have lots of different ways we do that. And Bethany mentioned at the beginning, our mini course, which is kind of a really common way that people like to introduce implementation science to their team members who are not necessarily implementation researchers. And then we have more intense ways that we go into courses and training related to implementation science in practice. And also wanted to flag, it was so great to see Graham Moore's talk this morning. We have just launched a beta version of Embracing Complexity, which is a special training series we're doing specifically on systems thinking and implementation science and how they can work together in a really practical way. So with all of that, I open it up for questions, and I think that people can type questions into the chat box. I see there've been a few already, and can also come off of mute and jump in and ask any questions.
I have a question. Can you hear me okay?
Yep.
Okay, great. So when you were talking about the what versus the why and how that's something that's sometimes pretty challenging, I guess I just wanted to hear more from you as to why you think that's so important. Is it just so there's more discussion around the adaptations with the larger stakeholder group, or like what do you think makes that what and why important?
What? So I think you're talking about the what and the how. So when we're talking about like, yeah, so what happens is sometimes people are adapting. So say you have Marie, can you tell me something you're implementing? Like a guideline, an evidence-based.
Sure. Yeah.
Okay.
So I mean, we're trying to think through how to better get physicians, pediatricians specifically, to follow the guidelines for lead screening and testing.
Perfect. Okay. So you want them. So your what has to do with physicians following screening guidelines. We'll make it super simple, right? So it's physicians following screening guidelines. And then you're going to use strategies to change physicians' behavior. And the question is, are you planning to make any adaptations to the screening guidelines? Or are you making adaptations to the strategies you're using to change their behavior? Like training them? Are you educating them? Are you embedding it in the EMR? Right? Do you have champions, opinion leaders? What are the things you're doing to change their behavior? And so sometimes people are adapting that guideline, and sometimes people are saying you cannot adapt the guideline, but you can maybe adapt those strategies you're using to change people's behavior. And I think the contentious conversations come sometimes because people say we can't adapt, but they really mean we can't adapt the guideline. But actually, we can probably adapt the strategies we're using to change people's behavior because we need to tap into their different barriers. Does that help?
Yeah, thanks. That's helpful.
Other thoughts or questions? Brian, did you have one?
This is Borshika. I put it in the chat, but I think it might be worth for us to have a discussion about this notion that sometimes the fit is just not right. And how do we make that decision? Because I have this intention, always to make things work. So I'm going to keep adapting and making it work. But you said that sometimes we should stop and say that the fit is just not right. There was one comment in the chat I wanted to point out. I know that it's hard to kind of go through. Someone who presented in the poster session and indicated that there is a scale that they use for HIV and IDA funded implementation research, perhaps, or yes, and that perhaps that can help with some cutoff values. So I just wanted to have a little discussion around how do we make that decision that no, this intervention will just not work.
Yeah. And Bethany added to that, like, when does it make sense to adapt versus to start from scratch? And I think that really, so I think that my experience has been, I have worked with people who said, in retrospect, we should not have adapted. We should have started from scratch. And I think often we come to that conclusion late in the game, and they are like, in retrospect, that's not what we should have done. And we just tried to push forward. I work in so many fields that I haven't seen one measure that applies. I think they're going to be topic specific. So if there's like an HIV one, then that might really work for a bunch of people, but I don't think there will ever be one standard measure for everything. And so I think, and so our level, maybe I can share, is we're trying to say, hey, this needs to be a pause moment for the team to think about this before they move forward. Because I think that's a common reflection that people have, is we maybe didn't move forward with the best option. But I'd love to hear other people's thoughts as well. Yeah, Brian.
So this is Brian, and I'm the one who made that comment in the chat. And you know, this is great. You know, the whole conference and this effort in general. I kind of, myself and several of my colleagues, I think, kind of maybe have a stance where it's like we talk about adapting and testing as opposed to adapting and assuming. And so it might be a hard line, but we sort of, I'm like, if the clinical intervention was shown to work in one setting and all that, and that is what defines it as an evidence-based treatment, we kind of think as soon as you start making adaptations that you no longer have the same evidence-based treatment. And so it might need to be tested as part of a type 1 hybrid trial, or maybe it's just pure clinical effectiveness research. I like the idea of the type 1 trials where you're also looking at implementation. In fact, after the plenary of this conference, I was talking about that dual randomized type 2 hybrid trial where we did that. I mean, we were taking a tried and true intervention that had tons of evidence, but because we were taking it into HIV service settings, we didn't want to assume that it would work. And so we were testing it simultaneously. It was definitely a beast, but we did that. In terms of but we wanted to make sure it had a pretty good fit from the get-go. So I do think assessing fit before a lot of efforts are done can save a lot of time. And the item that the measure that we developed and I just presented on really looks at 6 dimensions of fit: the fundability, the implementability, you know, are you able to retain the staff once you've trained them? Are you able to scale it up? Are you able to sustain it? You know, if things do quit, can you hire more? Is it timely? And so this is proven in our work to prove a pretty good measure for assessing, is something a no-go or not. And even if it is a decent fit, they're still going to require a lot of work in terms of getting it to go. But if something's too heavy a lift, it may not be the right time. Maybe a year or 5 years from now, it will be a better fit. I think it's a dynamic construct. So anyway, that's just some of our thoughts, but I really excited about the work that I'm learning about here with your presentation, and I might reach out to you. So thanks.
Awesome. That's fabulous. And Brian, I can say, I mean, I think that if there are researchers out there who are positioned to do those evaluations, I think that's 100% what should be happening. Personally, I am rarely working with researchers who are in that position. We're working with people who are saying, we're an NGO and we're about to implement this in 14 new states or districts. We're going, whether anyone's going to evaluate or not. And so I think the point is, in that situation, can they do it more systematically than the current kind of like, let's change whatever we feel like as we go? But I think that the possibility of doing systematic adaptations paired with research, and in fact, going into some of the frameworks that are coming up in the breakout sessions, I think is like a beautiful combination to really make those adaptation efforts much stronger.
Great. I think we're at the end of our time here today. We have just a little bit more to go in the conference. And so coming up at the top of the hour, 2 o'clock Mountain Time, we have a smaller breakout session on adaptation methods and frameworks, and hope you all will come. And then please do come for my closing address. Have lots of ideas to talk with you all about concerning what we do next year. So yes, thank you so much, Dr. Moore. This was fantastic. There's a Slack channel over here just raving about how wonderful your talk was. So thank you so much. And we hope to have you back sometime.
Well, thanks everyone. It was lovely at a distance, and thanks for your engagement through Annotate.